Thanks for staying with us. Let me tell you about Go Pharma app. Now, this is a smartphone app that aims to connect trained pharmacists in the city with untrained staff in rural pharmacies, allowing distant expertise and support to aid the distribution of medicines. Now, this app concept is currently being piloted via WhatsApp in the Greater Accra, Brong-Ahafo, and the eastern regions of Ghana. It's providing a platform for testing before the launch next year. So we are honored to have with us in our studios the app developer and Sandoz senior leaders to help us understand more about this. Fiona Cook and Elvin Blankson have joined us to tell us more. Lady and gentlemen, welcome.
Thank you. Thanks for having us.
Wow, great to have you. Now, let me begin with you, Elvin. What do you do?
So I'm a pharmacist by profession. Yeah, and I've done a lot of retail pharmacy over the years, but now I'm focusing mainly on Go Pharma to address the gap in healthcare in the rural areas. Yeah.
So from retail pharmacy to app developing.
Yeah, well, basically I have a master's in public health, so that trains you to think more holistically about healthcare provision. So that's also one of the main influences of me moving from just doing one-on-one patient care to trying to solve a challenge which affects quite a lot of people across the country.
Yeah, so what inspired you to build this up?
Well, like I said, I've been around the country a bit, especially in the rural areas, and when you go there, you see the lack, especially in people being able to access healthcare information and it being able to access medication. And seeing that, and also in my personal capacity as a pharmacist, I have a lot of friends, especially outside the country, some in here outside the country, who would call me and say, oh, my mother got a prescription, what do I do? Or I need this medication, where do I get it? Stuff like that. Or I have this disease, I'm taking this drug, is it okay? Should I do it? Shouldn't I do it? How should I do it? Okay, and you look at it and I go like, okay, so if I can help people here, me sitting here help people in America and the UK who are friends of mine or friends of mine to solve their challenges that they need, then it should be fairly simple using similar technology in the rural areas, because in Ghana we have really high penetration for both smartphones and
136%.
Exactly, and smartphones are somewhere around 72%. So that's really, really high. So it's the same thinking that went into trying to implement something like this and see how it will revolutionize healthcare in the rural areas.
Yeah. So tell me, how has this journey been so far? How many lives have you been able to transform?
Well, I think the patients will be the best people to tell you, but we're
a modest man.
Yeah, well, we're doing, I'd say, pretty good. We're in 16 outlets right now in the pilot phase.
Okay.
We're getting a lot of calls. People usually, because time is a sensitive matter. So people go to, people are sick, they're already in distress. They go to the pharmacy and they need quick resolution so that they can go back and do their own thing. So if you can solve the problem there, then people don't need to travel over distances to go and look for another healthcare facility. Plus, as you know, in this country, we do the NHIS. And at the pharmacy level, if you are able to solve most of the problems at the pharmacy level where people are willing to pay more out of pocket, then it lessens the burden on the health insurance scheme as well. So that's also, something that went into the thinking of it, because the problems and the challenges we've had with health insurance already. So
right, sounds very informative there. So I believe all this became possible through the hack challenge. Right, so Fiona, tell us about the Sandoz hack challenge.
Sure. So I'm Fiona, I work for Sandoz, global pharmaceutical company that specialises in generic medicine. And as a pharmaceutical company, we don't always know where all of the healthcare challenges are around the world. Indeed, we don't always even know the questions to ask. But Elvin is a great example of somebody who does know the questions to ask, and he does know the potential solutions in his country. So we decided as a company to run the Sandoz Healthcare Access Challenge, and we wanted to look for young people who had inspiring ideas to improve access to healthcare in their local communities. We ran the competition and we received over 150 ideas from over 30 countries.
Wow.
So we were really impressed with the quality of the entries that we received. But we felt that Elvin's idea really stood out, and he was shortlisted as one of the finalists. The finalists were in London, and we selected 3 overall winners. Go Pharma were one of the winners. And they received some funding from the company and also mentoring support to help get the idea off the ground.
Wow, so congratulations, I know that I must say, for making the nation proud.
Absolutely.
So Fiona, how does one apply to compete in this challenge?
So Sandoz Hack was a pilot last year. We had this inspirational idea to run the competition and find healthcare access pioneers like Elvin around the world. It went really well. We were really pleased with the results and the quality of the ideas that we received. So we will be running it again. We're just planning that out at the moment, and we'll be launching Sandoz Hack version 2 early next year.
You can say 2.0.
Yes, absolutely. I think that's a nice way to put it. So for anybody out there that's really interested or can be inspired by Elvin and Go Pharma, I would encourage them to apply to Sandoz Hack. Please check the Sandoz website, sandoz.com, and also we'll be campaigning on Facebook and the social media channels to find healthcare access pioneers of the future.
Wow, I love the sound of that. Healthcare pioneers of the future.
Yes, absolutely.
I'm sure there are a number of them on, watching us now, and who will later be watching us on social media, who are interested in this. But Elvin, how can we get access to Go Pharma now?
Basically, they are at with the pilot now, they are at the pharmacy or the licensed chemical shops. So if you're a patient listening and you go to the pharmacy, I would suggest that when you get there, you insist on speaking to a pharmacist, and then you get direct access to a pharmacist. Wherever you are, whether in the rural areas or wherever, you will get direct access to a pharmacist to help you out. And
so this is an app that goes to the pharmacist specific.
Well, yeah. So the pharmacist is at the back end, because most pharmacists are in urban areas. So the pharmacist is at the back end, and then the technician in the shop, usually they have the smartphone. So when the patients come in and they need any help at all whatsoever, the technicians contact us, and then we speak to the technician or to the patient, try and resolve the problem. There are even instances where we don't know all the answers, so we defer to doctors. So we're also finding ways of getting doctors on board so that we can solve the problem once and for all at the pharmacy level without getting too many referrals going to the clinics and the hospitals.
Yeah, I like the sound of it because, there's this element of building capacity even of these technicians.
Exactly.
Yeah.
Exactly. That's one thing. That's another thing, training and continuous training. Because in this country, we do a lot of continuous education, but you do it once a year and that's it. Our model is we continuously train these technicians on a weekly basis. On a weekly basis, we are giving them information and trying to train them, because you don't know when you will come into contact with a challenge that you can't handle. So it's best to be prepared than to do the 1 year thing and wait till another year. So we're also looking at doing it for the technicians, for the pharmacists to standardize knowledge, and even for the doctors that we're looking at bringing on board. Right.
So for some of these persons who may be watching, how can they contact you?
Well, if it's okay to give out my phone number.
Yeah, do that, please.
Yes, my phone number is 0206 338 346. So anybody that's interested, anybody that wants to help, anybody that has any ideas.
Can you repeat the phone number for us, please?
It's 0206 338 346.
338 346. 0206 338 346. Is there a website as well?
It'll be out in about 2 weeks.
2 weeks. Yes. So for now, we can visit
but
the Sandoz website.
Or you can link me up on Facebook or any other social media sites. I'm open to any of that.
Right, right. So let's take the Sandoz website again and your final words as well.
As we said earlier on, Sandoz Healthcare Access Challenge will be launching again early in 2018, and I would just ask anybody who's got a great idea to come and join us. Tell us how you would improve healthcare access in your local community, and I keep my fingers crossed that we will have another winner from Ghana next time around.
My fingers and my toes are crossed, trust me. Elvin,
Yeah.
your final word.
Like Fiona said, one person will not have all the answers. And for me, I'm not looking at saying I do have all the answers. So anybody out there who think they have any ideas, any support, any form at all, just get in touch with me and we'll move it forward.
That's great, on the phone numbers that he mentioned. So those are our friends from Go Pharma. The challenge is up to you now if you want to join up with the team. Now, this is News Desk. I'm Daniel Dazi. Stay with us.